Taking a break from cooking to talk to Dr. Ryan Woods. He is a fellowship-trained sports medicine physician at Aurora BayCare. And Dr. Woods, today we're talking about a brand new skill set that you bring to the team called Orthopedic Biologics.
Correct.
What is that? What's that mean?
Yeah, so orthopedic biologics, some people use the term regenerative medicine. It's a new and exciting area of orthopedic medicine where we attempt to harness the body's natural healing abilities to promote or enhance tissue repair, to improve pain and function in patients who suffer from chronic or acute orthopedic conditions.
So what is PRP and conditions you may prevent and treat with it?
Yeah, so PRP stands for platelet-rich plasma, and it's one of the orthobiologic treatments that we do offer. So basically, PRP attempts to harness the power of platelets. So platelets are a part of your blood that contain a variety of growth factors and chemical signals that are used by the body naturally to modulate inflammation and initiate tissue repair. And so what we can do is harness that power by drawing your blood, isolating these platelets, concentrating them to very high levels, and putting them back into areas of injury to, again, promote that healing environment and improve pain and function. And so common conditions that we do treat for these are things like arthritis. Knee arthritis, for example. We do a lot of work with tendon injuries, chronic rotator cuff injuries, tennis elbow, etc. And so again, it's kind of a middle ground between our traditional conservative treatment options and our surgical interventions.
I play tennis, so the tennis elbow thing, I know so many of my friends suffer from that, and it's just, it's not an easy
very
thing.
Common, very common.
Stem cell therapy, can you talk a little bit about that and how your involvement in that?
So that's another an option that we carry, another orthopedic treatment options. And so it really revolves on the same idea as the platelets, that we're using the body's natural ability, in this case, cells, stem cells, to promote improvements in pain and improvements in function. And so the cells work similar to the platelets in that they go in and they release a bunch of different growth factors and chemical signals to modulate inflammation, have a very strong anti-inflammatory properties to it. But in addition, these cells have the ability to potentially differentiate into target tissues, things like cartilage and tendon and bone and tissues of that nature, which is very exciting in the orthopedic world. And so, you know, they potentially have that additional benefit in regards to tissue repair and tissue healing going forward.
So a lot of new technology that we're using here in the area, and something that is, I think, people would get very excited about is non-operative sports medicine. So, you know, that's really what you are all about.
Yeah, so yeah, and this is a exciting area of medicine as well, in that we are now, with advances in technology, able to provide additional treatment options from the traditional conservative management to surgical interventions. And so, as mentioned, we do a lot of these minimally invasive procedures, some of which now are these orthobiologic procedures, but in addition, we do offer some micro-surgery, micro-debridement procedures under ultrasound guidance for things like tennis elbow and plantar fasciitis and other things that traditionally may require surgical debridement, where we can do these under ultrasound guidance. And so not only do we use ultrasound for guiding treatment options such as various injections, we do use it for diagnostic purpose as well. And that's really where it holds a very powerful, adds a very powerful value to a practice such as a non-operative orthopedic specialist, and that we can help, one, make diagnoses, and two, help with our surgical colleagues in their planning. We're able to identify various nerves and tendon structures and allow them to kind of get a roadmap of the anatomy prior to any surgical intervention.
Bottom line, there's a lot of new technology, and you're doing it, and you can find out more about it. There's a seminar coming up Thursday, December 13th.
Correct. And so we prefer people to sign up ahead of time so we can get a little bit of a head count, but all are welcome. It's a free seminar, and at the seminar we're going to talk a little bit more in detail about these orthobiologic treatments that we are offering, who may be candidates, who may be or may not be candidates, as well as discuss these other procedures that minimally invasive procedures that we do offer here at our practice.
All right. Thank you so much.
Thank
really
you.
appreciate it, Doctor.
Thank you for having me.
And we'll put all the information on this on our website. Appreciate it.
Thank you.
Coming up, back to the kitchen with some more delicious holiday recipes, so stay with us.